this accelerating epidemic, what must governments do? The first and foremost issue is just the old thing that we've been saying. Bring forward cases, encourage people to report if they have any symptoms. Contact tracing, extensive contact tracing with quarantine and with positive isolation repeatedly. You must be quarantining at least 50 to 100 people for every case. That's the sort of ratio at which you get hold and are able to control it. And for that, the feedback from the quarantine centers and the isolation centers to the general population is that it's good, clean place, they take care of you. If such a message is there, people will come forward. But if they feel they are going to be tortured over there or be made to suffer, they will not send their children, send their old parents to such a place. So that's the first thing. The second thing is the right to care. If a person comes with illness to a hospital and wants admission, the government, it's a government hospital, the government must be committed to admitting him. If we have run out of beds, it is the responsibility of the government to put him on a separate ambulance and move the patient to where the nearest bed is available. That this is part of the right to life. But here we are now, the denial of the right to healthcare is leading to a spread of the disease to the entire society. And people are going in search, sick people going in search of care is the highest source of spread, likely to be the highest. The related issue is that even if they go to the private hospital is unable to admit, whatever the reason, it should call the ambulance and the ambulance should arrange the transport. It cannot be left to the patient. It will be a cause of spread and it is unfair and illegal in a sense to do so. It should be made illegal to do so. And related to that is the right to testing. It's all right in the first month of the disease, you did not have enough tests, so you restricted it. After that, there is absolutely no reason why anybody symptomatic should not be tested if he wants to be tested. And others who need to be tested should be encouraged, maybe even incentivized to come and get tested. We know this. This is how we control malaria. This is how we control all other diseases. Test very widely. And then you would be able to pick up and isolate the cases in time. And this, India is still one of the lowest testing rates among all nations. And this is, I think, the serious problem about it. And when it comes to social restriction, do that for heaven's sake in an intelligent way. Just shutting down the whole place in a lockdown is inefficient. It is even getting to become dangerous on this because you are losing sight of the exact chains of transmission. But if you are doing contact tracing, you know the pathways through which it is spreading. It's a vendor over here, it is a policeman over there, it's a healthcare center over there. And with that intelligence information, you are able to take very focused action to restrict that movement. Otherwise, you can lock down a place, cause economic disaster, cause a huge lot of denial of healthcare, leading to deaths from many other sources, and yet fail to contain the epidemic. And that is perhaps the history of what has happened over here, that we've been putting our trust on overall restrictions without the necessary emphasis that is required for contact tracing and following up, and that has been extremely unsuccessful in containing the pandemic. So I think the importance of really intelligent and focused restrictions where there are identified chains of transmission rather than across the board lockdowns. Thank you.